comments coming my way all are very, very relevant, which I have a lot of time to talk about them, but I'll try to stay focused here. I'm going to talk from an educational perspective. The WWAMI program, what WSU is doing in collaboration with the University of Washington in this respect. I'd like to start with just a few sort of observations that I think are fairly conservative. One is that the physician is, and has been, I think will continue to be, sort of the center of the healthcare delivery that we have, regardless of how it changes. They're the primary deliverer, and things get organized around them. So when we're faced with a physician shortage, it's very critical for the entire system. The second observation that I think will remain fairly stable going out is the amount of time it takes to educate a physician. Right now, that's a minimum of 7 years, and it can range up to 11 or 12, and some specialties even more. So it's a slow pipeline to improving a shortage situation, which right now we find ourselves in. So thus, our part of the emphasis on creating more educational opportunities for physicians in Spokane and Eastern Washington in our area. And I just would like to point out, I hope I'm stating the obvious, but Spokane has a very disproportionately high clinical services sector for the size of its town. And one of the unique features, I think, of medical education in particular is that much of it is done by physicians in practice. Of those 7 years that I just mentioned, 5 years of those training occur in some sort of a clinical practice setting. Also, interestingly enough, physicians, as part of their professional oath, actually pledge to teach the next generation of physicians. So there's a lot of culture of education built right into the system. So when you look at a place like Spokane, which really sits at a hub of this big, large, rural, underserved area, and think about growing medical education, we have a lot of capacity to do that. And it's an important thing for the workforce, but I think it also has very, very beneficial effects on the healthcare delivery where that education occurs. So in other words, you get improvements in the existing system along with expansion of it. The other thing to say, and again, this might not be obvious, but this medical education pipeline, which is somewhat complex, many parts, all has to grow together, and in fact is very interdependent. So where I sit with first-year medical students, and I work with my colleagues that educate third and fourth-year medical students currently here in Spokane, we're talking about adding a second year, which would simply complete that undergraduate medical education pipeline. Very important piece. But without growth in the graduate medical education part, we haven't really improved the situation. So that's why we're emphasizing the entire pipeline. But it actually goes a level deeper than that, in that this pipeline interacts with itself. So as you grow graduate medical education, and as you have more residencies, your capacity for being able to educate the undergraduates goes up as well. When you have more undergraduates in your community, you have more interest in your residencies. And so the whole thing sort of grows very organically together. So these things are all very blended, and I hope in just these 2 minutes I've sort of painted a picture of why Spokane is an exceptionally good city to look at for this kind of growth. So with that, those sort of just my comments and observations. I'd like to say a couple things about what we're trying to do with the WWAMI program in WSU at the Riverpoint campus. And one of those, of course, is expansion, making our programs bigger. But in particular, when you look at the shortage of physicians that's coming, and we're already in, it gets more acute as you look at our more rural and underserved areas, and it also gets more acute as you look at producing primary care doctors. The WWAMI program actually does very, very well in producing primary care doctors, but it probably doesn't do as well as it could. And I would say all the comments about accountable care and what group health is doing with the medical home and all these wonderful models that are emerging for better preventative care and better primary care actually are leveraged by the availability of these primary care physicians. They become critical to this new mode of medical care delivery that is more accountable and more focused on keeping people well as opposed to treating them when they get sick. Also mentioned was the interprofessional piece of this, and one of the things we don't typically do in the educational setting is integrate our students together and teach them in the kinds of interprofessional settings that they will practice in when they get out. It's an overt goal of WSU Spokane, all of our healthcare programs, as well as the University of Washington School of Medicine and the WWAMI program, to begin to do this more effectively and work with partners that are practicing in this way. I just want to comment on this connection to dentistry because at Minnesota and here, I've been teaching dental students and medical students really my whole medical education career. And it is very important what happens in the mouth. And it is, as my dental colleagues would say, the window to the rest of the body. Much of what happens there preludes things that are happening in other areas of the body. In our programs, our dental students take roughly 20% of the curriculum together, but most importantly, they take their first-year clinical medicine course together. I think we might be the only place in the country that actually does that. We're not the only ones, but one of the very few, where our dental students and our medical students sit together in small groups with dental preceptors and medical preceptors and talk about clinical problems together. So they get a very organic exposure to, you know, what and how each other practice once they're out of the educational setting. And one personal piece for me, I think, is also going to be very important in relation to what Dr. Schaefer said, is technology, and David's as well. Technology is changing very rapidly. We, in the educational side, have to make sure that we are preparing our students not by just teaching them what we think they need to know, but teaching them how to acquire information they will need later as things change. Much of the technology, the Human Genome Project, which is now put in practice with signature genomics, is continuing to advance. I think the first human genome cost $2 billion to sequence. Now, when you want to do a whole genome sequence for a research project, you budget about $8,000 for that sequence. That's 6 orders of magnitude decrease in cost. That's a big decrease. So we're looking for the day when this goes under $1,000, and I would say by the time the students we're teaching now are in practice, they will have patients that are in their practice with full genome sequences, and they're going to ask their physician questions about it. So they need to be ready to answer some of those. Just a couple last quick points. The other thing that's tied to this whole expansion idea and more education of physicians and other healthcare practitioners is the research component. And we're effectively trying to build that here in Spokane. I think signature genomics is a wonderful example of what can happen when you have research in your town. It does things on the cutting edge and spins out into very important companies that deliver healthcare services. And I think there's other kinds of research that we need to delve into, such as translational research, which helps implement discoveries that are already made, help make them part of normal practice in community healthcare settings, such as we have here in Spokane. And then the last piece, of course, and not only do we need to, think about health and wellness in our primary care settings, but as educational institutions, we need to make sure that our students are getting out and also promoting this, basically a culture of health and wellness. And I'll just put a plug for one of the things that Washington State University has had for years in using the agricultural setting, and that is the extension programs, which go basically into every county in the state. And more of those programs are shifting over to delivery of health care, or basically health and wellness messages, so that we can get this message out in an effective way and dispense what we're learning more in the academic center.